Dr. Vinitha Reddy, Consultant Radiation Oncologist at American Oncology Institute, Hyderabad. Can cervical cancer develop without any symptoms in the early stages? The options are option A, no, it always causes symptoms in the early stages. Option B, yes, it can remain asymptomatic in the early stages. Option C, only in women who have had hysterectomy. And option 4, only in women who are over the age of 90 years. The correct answer is option B. It can remain asymptomatic in early stages. Cervical cancer can present without any symptoms, and it can cause symptoms in the late stages, and the most common symptoms are white discharge, bleeding PV, post-coital bleeding and postmenopausal bleeding. If you test positive for HPV, does it mean that you will develop cervical cancer? Definitely. Option A, HPV infection always causes cervical cancer. Option B, no. All HPV infections may not cause cervical cancer. Most of them clear spontaneously. Option C, if you have multiple sexual partners. And option D, if you keep regular pap smears. The correct answer is option D. Most HPV infections clear naturally and spontaneously without causing cancer. And your body's immune system helps in controlling the HPV infections and clearing them naturally. But only the high-risk HPV types cause cancer. How long can cervical cancer remain dormant without potentially causing cervical cancer? Option A, it doesn't remain dormant, it causes cervical cancer immediately. Option B, 6 months to 1 year. Option C, over a period of 5 years. And option D, 10 to 15 years or more. The correct answer is option D. HPV infection can remain dormant for over a period of 10 to 15 years before potentially causing cervical cancer. Hence, it is important to go for regular pap smears at least once in a year or two and get tested for HPV infection. And if it is positive, get treated for HPV with proper antibiotics, maintaining proper pelvic hygiene and practicing healthy sexual practices.